This is a public service announcement for swine vaccination protocols. Vaccinations are given to keep the swine healthy from potential threats such as porcine reproductive and respiratory syndrome, also known as PRRS, porcine parvovirus, PPV, swine influenza, rotavirus, Ehrlichia, atrophic rhinitis, and leptospirosis. Which vaccine should I use? In live vaccines, the organisms have usually been inoculated, so that although it will multiply in the pig, it will not normally cause any cause of disease. Examples are the PRRS vaccine, Aginski's disease vaccines, and classical swine fever vaccines. Live inoculated vaccines have the advantage that because they multiply in the pig, they give a bigger antigenic stimulus, resulting in stronger, longer-lasting immunity. The most common form are killed vaccines and do not require on-farm mixing and have minimal risk to pregnant animals. Inactivated or dead vaccines may contain whole organisms, antigenic parts of organisms, or antigens which have been synthesized chemically. An example of a commonly used whole organism vaccine is the Ehrlichia vaccine. Method of administration of vaccines. For vaccinating adult or weanling pigs, use a 5 ml syringe and a short 19 or 20 gauge needle. To avoid transferring diseases, always use a sterile syringe and a different needle for every animal. Vaccines and deworming injections are injected subcutaneously above and behind the ear in an adult boar or sow. In younger pigs, injections can be done intramuscularly in the thick rump muscles halfway between the hook bone and the pin bone. Intravenous injections are generally administered into the ear vein with a short 21 or 22 gauge needle. If a pig is aggressive, which most are not, loop a rope over the snout and hold it to one side. Then place a second loop over the snout and generally pull it to the side direction to hold the pig still. Here is a suggested schedule of vaccinations for diseases and the vaccine timing, as well as comments of when boosters should be given routinely.